Then President Cyril Ramaphosa has warned the nation not to let its guard down when it comes to the coronavirus pandemic. He's urged people to get vaccinated and take all necessary precautions to stay safe. Ramaphosa started feeling unwell after leaving the state memorial service held for apartheid's last president, F.W. de Klerk, in Cape Town yesterday. The president, who is fully vaccinated, is receiving treatment for mild symptoms. Well, virologists and epidemiologists are encouraging families to think of additional measures to keep vulnerable family members safe from COVID-19 over the festive season, especially with social gatherings likely to increase unless there's an announcement from the National Coronavirus Command Council to the contrary. It's due to meet, as we've been saying, tomorrow on Tuesday to discuss the possible tightening of lockdown restrictions. For more on this, let's speak to Professor Helen Rees, who's the leading South African leg, who's leading the South African leg of identifying treatments for COVID-19. Professor Rees has also been involved extensively in advice given to the government in dealing with the pandemic since March of 2020. Prof, a very good evening to you. Always good to have you on Newzroom Afrika. Can vaccinations and masking and distancing get us through the busy festive season where we're expecting more gatherings to happen without too serious of a surge in infections and possibly deaths?
Well, I think the first thing we must remember is we've got this huge Omicron outbreak. Gauteng was the first province, but other provinces, as we know, are now following suit. So those provinces still have to see a peak and a surge. And if we saw how quickly the numbers increased in Gauteng, then the message is that people still have to be really, really careful. This is a very transmissible variant, and we've seen it sweeping through families and workplaces. We've seen closure of workplaces, and now, of course, it's in the presidency as well. So the message is, unfortunately, all of these measures are still really, really important, and people shouldn't just sit back and say, Omicron isn't as bad, because we still don't know that for certain in terms of disease severity.
And Boris Johnson, the UK Prime Minister, speaking a short time ago, said that the UK now has recorded its first Omicron-related death. And he said we need, as you're saying, he was saying that we need to move away or set aside at least the idea that it is a less severe variant of the COVID-19 variant of virus, I beg your pardon, Prof, and focus on its pace as far as infections and vaccinations. Is he right?
He is. I hope that you can hear me. I see my internet is unstable.
We can hear you clearly, Prof.
Good, good. No, he is correct. The Omicron is a new variant. We're still learning about it. We know it's more transmissible. That's why the numbers have gone up. We think that the disease severity and the disease profile has changed a little bit, and that it's not as severe as the Delta. But we're still collecting that data, so it's far too soon to sort of sit back and shrug our shoulders. We also know that some of the people who are becoming infected have been vaccinated, and some have already had an infection with the previous variants, Delta and Beta. So we know that this variant is escaping the protection from antibodies, that whether it's from natural infection or from vaccination. But the last thing we really do know is that many of the people that we are seeing admitted to hospital have not received a vaccine. So even if people who are vaccinated are becoming infected, we're tending to see that this is a mild to moderate disease, and the people who are getting severely ill are those who have not been vaccinated. The message is the same. You have to get vaccinated. It's just really, really important.
This coming weekend, the weekend of the 16th of December, the first of the December long weekends, do you expect that to be the true test, shall we say, or the first true test of the current lockdown measures if there's no change, because people will gather more and many will be traveling as well?
Yes, well, I think just be very careful if you're traveling, or, you know, the mask wearing we now really understand is incredibly important, and the sanitizing. But ventilation is really important. This virus likes to hang around in aerosols in the air for quite a long time. So the old idea that it's only if you're really close up to someone, that's not true any longer. So ventilation and all of those measures, mask wearing, proper mask wearing, really, really important. But you're right, we're going to have to see what actually happens now with gatherings and social gatherings and family gatherings. And, the Command Council is going to have to be on its toes, because if the numbers shoot up, then the MAC will have to reconsider, the Command Council will have to reconsider, and particularly if we start to see pressure on the health services, then things really will change, because we can't allow the health services to crumble because of pressure of cases.
Given, Prof, the rapid spread of Omicron, as you're saying, the MAC, the Ministerial Advisory Committee, will have to be on its toes. I wonder how much the speed at which this virus is multiplying, how much room that gives the people who need to make the decision-making room to maneuver and respond as fast as possible.
Yes, I think, and I'm glad you asked that question, because I think sometimes we haven't explained well enough how the MAC and the vaccine MAC work. And so all of the experts and additional experts who advise those MACs, so there are huge crowds of experts from the country who've been pulled in, continuously evaluate the data. And either the minister will say, please, can I have an advisory on this, or the Department of Health, or members of the MAC themselves. So if we see that things are changing very fast, for example, the booster doses and the vaccine MAC, then the MACs can themselves write an advisory as quickly as they can. But it has to be evidence-based. We're not going to just hear something or read something in the newspaper and then say, this is what we think we'll do. So the evidence has to be carefully evaluated, and that just in and of itself does take a little bit of authority, as reviewing the data from applicants, a separate process, a very important process. And then the health department puts everything together and then decides with the minister what would work programmatically. So it is a bit of a process, but behind the scenes, I promise you, there are teams of people who are working 24/7 on this.
Professor Rees, just a final question then. Last night, we saw the NICD having to explain what appeared initially to be somewhat of a discrepancy or a difference in the numbers reported by the health department and the NICD. We then learned that there's been an issue in IT systems, I believe it is, at public laboratories where COVID-19 results are to be captured. So 19,000 plus positive results were added to the tally last night, but those were from previous days. How concerning is that situation for you, especially as we try to get the best data in the fastest possible way on this outbreak?
Well, obviously, everyone would be very concerned, including NICD and the laboratories would be very concerned about any mistakes in the data. But if you think about it, up till now, South Africa has been really exemplary. I mean, not only have we seen the genomics just taking a world sort of lead, but it's backed up by the data that NICD, the labs, that everyone is collecting, that allows us to be able to say what is happening in our hospitals, what are the people vaccinated, yes or no. We've got the MRC and teams of researchers out there. So, yeah, this was a mistake, and I think they would be the first to say that. But by and large, I think when the dust settles, and let's hope it does after COVID, I think that we will look back and say, really things were done with really committed scientists and clinicians and individuals, who've really done their best. And it really has been, I think, a fairly good job so far. Yeah, could we have done things faster? Yes. Could we have got the vaccines out faster? Probably yes. But we've now got 27 million vaccines out, and we're trying to increase that. So, you win some and you lose some. This was a mistake. It was acknowledged. But by and large, this has been a very well-conducted set of monitoring.
Professor Helen Rees, good to speak to you. Thank you for your time, ma'am. Professor Rees is leading the South African leg of a global trial to identify treatments for COVID-19, speaking to us less than 24 hours before we expect a meeting of the National Coronavirus Command Council to happen, to be chaired this time by the Deputy President, David